Welcome back to the Deep Dive. This is where we take what can seem like really dense, complicated information, the kind you find in research papers or medical handbooks, and we unpack it.
Right.
Our goal is really just to pull out the absolute most important stuff, the key insights, the practical takeaways that matter most to you.
That's exactly it. And today we're tackling a topic that's incredibly important for anyone facing peripheral arterial disease, specifically the prospect of a femoropopliteal bypass procedure.
Oh.
We've gathered insights from, well, a whole range of sources, clinical guidelines, surgical texts, vascular medicine manuals, all with one mission, really, to create a clear, understandable roadmap for a patient who needs this surgery.
Think of it as a guide designed specifically for you, the listener, if you or maybe someone you care about is navigating this journey. We're going to walk through what to expect, step by step, from getting ready all the way through to living well afterward. Let's dive in. So let's imagine you've just learned that this femoropopliteal bypass might be necessary. What's the very first part of this roadmap? What should you actually be doing to prepare before that procedure date arrives?
Yeah, that initial phase is really all about getting a thorough picture, both of your overall health and the specific issue in your leg. It starts with a detailed evaluation by your medical team.
Okay.
Expect them to take a detailed history of your symptoms, ask a lot of questions, and perform a physical examination.
What does that physical exam involve, specifically for this kind of, leg artery issue?
Well, they'll be doing things like checking the pulses in your feet and legs. These pulses, they tell them how well blood is flowing, right?
Right.
The sources also mentioned they might listen with a stethoscope over your arteries. Sometimes they can hear a kind of whooshing sound there.
Whooshing sound?
Yeah, it's called a bruit. It can indicate turbulent blood flow, often caused by a narrowing. And they'll carefully examine the skin on your legs and feet, too, looking for any changes that might be related to poor circulation.
Okay, so it's about understanding your symptoms, seeing the physical signs. What about tests? I imagine they need to, look inside the vessels as well.
Absolutely. Blood tests are essential. This includes checking your complete blood count, looking at red cells, white cells, things like that, and assessing your electrolyte levels, and crucially, how well your kidneys are functioning.
Kidney function, okay.
These tests provide a vital baseline for your overall health and help the team understand any potential risks before you even get to the surgery.
So they know your general health status.
Yeah.
And then comes the imaging to actually map the blockage.
Precisely. Imaging tests are crucial for mapping out exactly where the blockage is and, planning the bypass itself.
Yeah.
The sources highlight duplex ultrasound as a key tool here.
Ultrasound?
Yeah, it uses sound waves to create images of your arteries, and it also measures blood flow. It's known to be particularly accurate for detecting blockages in patients who are experiencing severe leg ischemia.
Ischemia, that's the restricted blood flow causing pain.
Exactly. Restricted blood flow causing pain, numbness, maybe even skin damage when you're resting, not just when you're walking.
Is ultrasound the only imaging they might use? Or
Not always, no. Depending on what the ultrasound shows or just your specific situation, they might also use other tests. Things like CT angiography or MR angiography.
Okay.
CT angiography uses X-rays and a special dye for detailed cross-sections of your blood vessels. MR angiography uses magnetic fields and radio waves. Both essentially give the team these really detailed maps of your internal plumbing, so to speak.
Like a blueprint. A very detailed blueprint of your arteries and where the problem spots are using different tools.
Exactly right. And based on all of this, your history, the physical exam, blood tests, the imaging, your medical team will also assess your individual risk. They look at any other health conditions you have, what we call comorbidities.
Like heart disease or lung problems.
Yeah, exactly. Things like that, plus your overall health status. It helps them tailor the best and safest approach for your specific surgery.
That makes complete sense. Understanding the whole picture, not just the blocked artery. Okay, so the planning's underway. What are the most important things a patient should focus on managing in their own health leading up to the procedure?
This is a really critical area. This is where you, as the patient, can have a huge impact on the outcome. The sources strongly emphasize addressing key risk factors for peripheral arterial disease itself, that's the underlying condition causing the blockages, and also factors that could increase complications during or after surgery.
And what's the absolute, number one thing here? Is there one?
There really is. If you are a smoker, stopping smoking is the single most crucial step you can take, period.
Wow.
Smoking is a major driver of PAD, and it just dramatically impacts blood vessel health. Quitting, even if it's quite close to the time of surgery, can significantly improve your healing and the long-term success of the bypass. It's genuinely that important.
Single most crucial step. That really highlights it. Okay, what other health factors need close attention before surgery?
If you have diabetes, working closely with your doctor to achieve really good glycemic control, that just means keeping your blood sugar levels well managed, is extremely important.
Why is that so critical right before surgery?
Well, poor blood sugar control can damage nerves and blood vessels over time, and that increases the risk of complications like infections or poor wound healing after the operation. It's especially important for preventing things like foot ulcers, which are often linked to both nerve damage and poor blood flow from diabetes.
So, quitting smoking, getting blood sugar under control. Those are top priorities before surgery. That gives a really clear action plan for the preparation phase.
Okay, let's move forward in our roadmap. You've done the prep, managed those risk factors, and now it's the day. You arrive at the hospital. What should you expect when you're admitted?
Okay, so when you arrive, you'll go through a series of safety checks. These are standard procedures in any hospital before a major operation. In the operating room itself, they often call them timeouts.
Yeah, it involves the whole medical team just pausing to confirm really important details like your identity, the exact procedure you're having, and crucially, which leg or side of your body is involved. It sounds simple, but it's a vital step to make sure everyone is perfectly aligned.
Sounds like a critical safety net. Absolutely. What happens once you're actually in the operating room?
You'll be positioned on the operating table. For this type of bypass, you'll typically be lying flat on your back. The medical term is the supine position,
Okay.
and the team will take care to pad pressure points on your body. That's important for comfort, of course, but also to prevent issues like pressure sores, especially since the procedure can take several hours.
Padding makes sense for comfort, yeah. Will you have any temporary medical equipment attached? Lines or tubes?
Yes, usually. Certain temporary lines or devices might be placed to help monitor and manage things during the procedure. This could include a Foley catheter, which drains urine. Sequential compression devices, often these are like sleeves on your other leg that inflate and deflate. They help maintain circulation and prevent blood clots, and potentially an arterial line.
What's that for?
That's a small tube placed in an artery, usually the wrist, that allows for very close, continuous monitoring of your blood pressure throughout the surgery.
Okay, so temporary things to help the team keep track of everything. And then, of course, there's the anesthesia.
Right. Anesthesia will be given to ensure you're comfortable and feel absolutely no pain during the surgery. The sources mention a few options. Sometimes local anesthesia, which just numbs the specific area.
That's the leg.
Or maybe just the incision sites, yeah.
Yeah.
Or a regional nerve block, which numbs a larger area, like the whole leg, by injecting medication near the key nerves. The anesthesia team will talk to you beforehand about the best approach for you, based on your health and the specific surgery plan.
That's helpful in visualizing those steps leading right up to the surgery itself. Now, let's talk about the core of this deep dive. The femoropopliteal bypass procedure itself. What actually happens during the operation?
Okay, so during the procedure, the first thing is the surgical team prepares the area. They use special antiseptic solutions to clean the skin and place sterile drapes all around. Maintaining a sterile environment is absolutely crucial to prevent infection.
Makes sense. Where do they typically begin the surgery, like the first incision?
To perform the bypass, the surgeon needs to get access to your arteries both above and below the blockage. The sources indicate that access often involves the common femoral artery. That's a major artery located right in the groin area. It's a common starting point.
And then they need to actually get to the arteries, right,
Yeah.
through the tissue.
Exactly. The surgeon will carefully dissect, which basically means work through the tissue layers to find and isolate the necessary arteries. For this specific bypass, they need clear access to that common femoral artery up in the groin and also the popliteal artery, which is located behind your knee.
Got it. One above, one below the blockage.
Precisely. They need those 2 points, one upstream and one downstream from the block section, so they can create the new pathway for blood flow.
And this is where the bypass part comes in, building that new path.
This is the key step. The surgeon uses a graft, which is essentially a tube, to create a detour around the blockage.
What's the graft made of?
It can be one of two things, usually. It could be a piece of your own vein, often taken from another part of your body, like the other leg or sometimes an arm. Or it can be a synthetic tube made of special medical-grade material.
Okay.
One end of this graft tube is connected to your artery above the blockage, and the other end is connected to your artery below the blockage. This lets the blood flow through the graft, completely bypassing that narrowed or blocked section.
Ah, like adding a new lane to a highway to get around construction or a traffic jam. How do they actually connect that graft tube to the artery? It sounds incredibly intricate.
It is. That connection is called an anastomosis, and it's a very precise surgical task. The surgeon carefully sews the graft to the artery using very, very fine sutures, tiny stitches.
Wow.
The goal is to create a perfectly smooth, tight connection between the inner lining of the artery and the inner lining of the graft. This ensures blood flows easily through the new connection and, importantly, doesn't leak. The sources even describe specific techniques like using fine running stitches to make sure that connection is secure and nice and smooth on the inside.
Fascinating detail about the stitching. It really underscores the skill involved there. Okay, so the bypass is successfully connected. Surgery's finished. What's the immediate period after the procedure like for the patient?
Right after the procedure, you'll likely be taken to a recovery area, sometimes called the PACU post-anesthesia care unit.
Okay.
This is where you'll wake up from the anesthesia and the medical team will be monitoring you very closely, checking your vital signs, heart rate, blood pressure, breathing, and keeping a close eye on the surgical site, the incisions.
And are there specific things they're looking for right away at the site where they operated?
Yes, definitely. The sources mention keeping a particularly close eye on the access site, often the groin area where the common femoral artery was accessed. It's possible to have some immediate swelling there or maybe some minor bleeding or oozing right at that spot. The medical term is extravasation, just a small leak of blood outside the vessel.
Okay.
The team will be watching for these things and managing them if they occur. It's usually minor, but they watch closely.
Okay, so close monitoring right after surgery, especially watching those incision areas. Now let's look ahead a bit further. You've recovered from the initial phase, you're ready to head home from the hospital. What's the focus after discharge?
Right. This is where the long-term journey truly begins. The care after discharge is absolutely central to the success and really the longevity of your bypass. The focus shifts now from the surgical repair to managing the underlying disease that caused the blockage in the first place.
So the surgery fixed the immediate problem, the blockage, but it didn't actually cure the disease itself.
Exactly. That disease is called atherosclerosis. You can think of it as a process where plaque, which is this sticky buildup of fat, cholesterol, immune cells, other debris, collects inside your artery walls over many years.
Like pipes getting clogged up.
That's a great analogy. It makes the arteries hard and narrow. The bypass creates a new pipe around one clogged section. But that underlying disease process, the atherosclerosis, it continues throughout your body's arteries unless you actively manage it.
That makes it crystal clear why long-term management is so vital. What does that involve practically for you, the patient, once you're home?
It means continuing to aggressively manage the risk factors that were fueling the atherosclerosis to begin with. We talked about them before the surgery, right?
We did.
And they remain just as crucial, if not more so, afterward.
Let's recap those really important ones again. It seems worth repeating.
Absolutely. Number one, if you were a smoker and you quit for the surgery, it is vital to never start again. Smoking just severely harms blood vessels. Full stop. Then, maintaining good control of your blood sugar if you have diabetes is non-negotiable. It's key for protecting both your nerves and your blood vessels long term. Managing high blood pressure is also critical that. High pressure puts extra strain on artery walls and contributes to plaque buildup.
And cholesterol.
And managing your cholesterol levels, yes, because cholesterol is a major component of that plaque that builds up in the arteries.
So lifestyle changes are foundational.
Yeah.
Definitely quitting smoking, healthy eating, exercise fits in there too, I imagine, and managing those key conditions like diabetes and high blood pressure.
Yeah.
Are medications also part of this long-term plan usually?
Yes, very often they are. The sources discuss how long-term medical management is really a standard part of care for peripheral arterial disease. This frequently includes medications aimed at preventing blood clots.
Why are clots a concern?
Well, you want to prevent clots from forming either in the new bypass graft itself or in your other arteries. So things like antiplatelet agents, aspirin, or clopidogrel are common examples. They help keep your blood from getting too sticky and forming clots. Medications to lower cholesterol, often called statins, are also very commonly prescribed to help slow down that plaque buildup process. Your doctor will figure out the specific medications and doses that are right for your individual needs.
So it's a combo.
Yeah.
Managing your lifestyle, and taking prescribed medications consistently to slow down that underlying disease process.
Yeah.
Now, while you're doing all that, managing everything, what are the warning signs? What potential complications should someone be aware of after they go home? What should make them pick up the phone and call their doctor?
Yeah, this is extremely important information to have handy. You need to be vigilant for changes in your leg, watch the surgical sites, the incisions. While some initial swelling or bruising is normal, if you notice increasing swelling, significant new pain, redness, warmth spreading around the incision, or any kind of drainage or pus,
Okay.
that could be a sign of infection, and you need to seek medical attention promptly. Don't wait on that.
Are there signs related more directly to the blood flow or the bypass itself failing?
Yes. A serious potential complication is a blood clot forming, either in your remaining arteries or, worryingly, in the new bypass graft. This is called limb thrombosis.
And what would that feel like?
Signs of this can include a sudden return or worsening of your leg pain, maybe new numbness or tingling, a feeling of coolness in your foot or leg compared to the other side, or even a change in the color of your skin. It might become pale or bluish.
That sounds urgent.
It is. If you experience any sudden significant changes like these, it's a medical emergency. You should contact your doctor immediately or go straight to the emergency room. Prompt action is absolutely key.
Those are really critical signs to watch out for. Don't ignore them. Don't wait.
Exactly. Prompt action can make all the difference in addressing potential issues effectively.
We've talked a lot about managing the underlying disease and preventing recurrence. This ties into something called long-term conservative management. Can you explain what that means in the broader picture? Maybe for people who haven't had surgery yet, or even after surgery.
Sure. Long-term conservative management basically refers to all the non-surgical strategies used to slow the progression of peripheral arterial disease and manage symptoms over the long haul. Even if you've had a bypass, these principles remain absolutely central to protecting your overall vascular health going forward.
Which brings us right back, it sounds like, to focusing on those risk factors we keep mentioning.
It really does. The absolute core of conservative management is aggressive control of those same risk factors. Stopping smoking permanently, excellent blood sugar control if you're diabetic, managing high blood pressure effectively, and addressing high cholesterol. These are the foundation, whether you've had surgery or not.
And medication fits into this conservative management picture too, right?
Yes. Ongoing medical therapy, including those medications like antiplatelets to prevent clots and cholesterol-lowering drugs, is often a continuous part of long-term conservative care. It's about managing the disease process systematically.
Is there anything specific within conservative management for certain patients? Perhaps thinking about those with diabetes again.
Absolutely. For individuals with diabetes, meticulous foot care is incredibly important, and it's a key part of conservative management because diabetes can cause nerve damage neuropathy, leading to reduced sensation in the feet.
So you might not feel a small injury.
Exactly. And combined with potentially poor circulation from the PAD itself, patients are at a much higher risk for developing foot ulcers that can become infected and be very difficult to heal. So, daily foot checks, looking for any cuts, blisters, or sores, wearing proper footwear that fits well, and getting prompt attention for any minor foot problem are vital preventive measures.
So long-term care, whether you've had surgery or you're managing PAD medically, it really boils down to aggressively managing those fundamental risk factors: smoking, blood sugar, blood pressure, cholesterol, taking your prescribed medications consistently, and paying specific attention to things like foot health, particularly if you have diabetes.
That's a great summary. It really is an ongoing process. It's a commitment, to protecting your vascular health for the long run. So navigating the prospect of a femoral popliteal bypass and then living well afterward. It really involves understanding several key stages. We've walked through the important steps to take in preparation, what to expect during your hospital stay and the procedure itself, the crucial things to watch for afterward, and maybe most importantly, those vital long-term strategies focused on managing the underlying disease and protecting your health.
It's definitely clear that while the surgery provides a critical fix for a blocked artery, the long-term success of that bypass and your future vascular health overall depends so heavily on managing things like smoking, blood sugar, blood pressure, and cholesterol year after year. And knowing those warning signs for complications is also really empowering, isn't it?
It is. And this deep dive, looking at the sources, it really reveals that atherosclerosis, the disease causing these blockages, it's often a silent, progressive issue. It can actually begin depositing plaque surprisingly early in life, decades before symptoms show up. And now it's a leading cause of serious health problems globally, especially as people live longer.
And that leaves us with a pretty significant thought, doesn't it? If this disease process that we're treating with bypass surgery is something that can actually start decades before symptoms ever appear, maybe even in childhood or young adulthood, what does this tell us about how we, collectively, should approach vascular health? Not just when we're facing surgery, but much, much earlier in life. Is vascular health something we should all be thinking about, from childhood onwards?
Something to consider.
Definitely something to think about. That's all from this deep dive.